Okay, here we go. So this is my favorite part, so if I get a little bit more animated, you'll know why. Okay, so remember I mentioned that I was going to just briefly talk on the history of water fluoridation because it would honestly take all day. So I got it down to 2 guys, but believe me, there's probably 25 people involved with how it came from high naturally occurring fluoride helping teeth to adding fertilizer waste product to our water supply, okay, because that's what it is. So this first guy, Frederick McKay, I mentioned him earlier. He's the dentist in Colorado Springs. I believe he was coming from altruistic means. I think he was truly trying to figure out why these people with the brown stains didn't have cavities. Okay, now, and remember, I have to say this again. We're talking about naturally occurring calcium fluoride. You guys know that that stuff is not absorbed that easily in the body. Your body kind of eliminates it pretty quickly. The industrial fluorides that's out of the water supply, those are highly absorbed. And if you don't believe me on that, just know this: the lethal dose, the dose that will absolutely kill you on naturally occurring fluoride is 3,750 milligrams per kilogram, 3,750 mg per kg. Industrial fluorides, 125 milligrams per kilogram. It's not even a contest, okay? So you have to understand, no matter what anybody says, it is not naturally occurring fluoride. It's not even sodium fluoride anymore, by the way, guys. It is hydrofluosilicic acid, waste product from the fertilizer industry. Okay, they can't legally put it in the ground. They can't even let it go up in the air. They have to install scrubbing stacks to catch it. That's how deadly it is. But for some reason, water is okay. So Frederick McKay, I think a good guy. This is not a good guy. This is Edward Bernays. Okay, he's the father of PR. He is the nephew of Sigmund Freud. And if you know anything about this guy, he is the reason why cigarettes became really, really popular. He was hired by the tobacco industry years ago. How do we make cigarettes get in everybody's mouth? And the guy was clever. I mean, he was really clever. Like, there was a cigarette company, I can't remember the name of the company, but they had an ugly, sort of a teal green package. It was hideous. And this guy was so clever, he went to Hollywood and started having all of the actresses in the movies wear that color, whether it was a dress or a shirt, and they would smoke. And I'm telling you, and if you don't see it going on in the past year, it works. You can convince people of anything. And it worked, and cigarettes became mainstream, and doctors started recommending it. And when a doctor speaks, everybody listens, right? That's not the way it should be. So Edward Bernays knew that if he could get people to listen to doctors, and that's what he did, was he said, well, let me get doctors to push this with their white coats, and they'll buy into it, and that's exactly what happened. If you ever want to learn everything you possibly can about this, get this book, The Fluoride Deception. If you don't like to read, you can probably go on YouTube and find little snippets of it when he's being interviewed by Paul Connett, who is the head of the Fluoride Action Network. I'm telling you, it's literally a page turner, and I'm not even kidding. You don't have to know anything about science. It's just so unbelievable how this thing just ran, and how people like Alcoa got involved and other industry that had waste product problems, okay? Incredible book. Look at this quote by Ed Bernays. Propaganda becomes vicious and reprehensive only when its authors consciously and deliberately disseminate what they know to be lies, or when they aim at effects which they know to be prejudicial to the common good. Again, does this sound familiar? Another quote from him that he said was, you can get practically any ideas accepted. If doctors are in favor, or a doctor, no pun intended there, the public is willing to accept it because a doctor is an authority to most people regardless of how much he knows or doesn't know. By the law of averages, you can usually find an individual in any field who will be willing to accept new ideas, and the new ideas then infiltrate the others who haven't accepted it. Another quote by him. Look at this. We are governed, our minds are molded, our tastes are formed, our ideas suggested largely by men we have never heard of. And with the exception of maybe 2 or 3 of you in this room, you probably never heard of Robert Kehoe, Gerald Cox, Oscar Ewing, or even Harold Hodge that I mentioned earlier. But these, make no mistake about it, these guys were powerful and had every intention of pushing something across that they knew wasn't that great. So this is another video I have. I hope the volume and everything is good. Farrah / Randall. This guy is a guy named Dr. Aaron Carroll. He has a thing online called Healthcare Triage. He's a pediatrician and professor of pediatrics at Indiana University School of Medicine. Seems like a nice guy. For some reason, he knows everything about everything, and so this is just one of his little clips that I found.
For 60 years, that proved the efficacy of water fluoridation. Some of the best studies come from the early days of fluoridation, because it was easier then to find groups of people who were not exposed to any fluoride source. In a 15-year landmark study in Grand Rapids, Michigan, children who received fluoridated water preferred 50 to 63% less tooth decay than children from a nearby city in Michigan who drank non-fluoridated.
All right, first of all, it was supposed to be a 15-year study. It ended up being 5 years. After 5 years, they said, we're good enough. They were comparing Grand Rapids to Muskegon, Michigan, and after 5 years, they go, it's good enough. Let's run with this. I don't know where he came up with 50 to 63, because what the actual result that they said was 18% less decay. Now, I'm going to show you the graphs that can dispute all of this, but they said it was 18%. Whoops, I got to do this one. 18% was the average. Notice on the left side, on the y-axis, you see 32 up there. That's the percent difference of people that did not have decay in fluoridated versus non-fluoridated, but the average was 18. Now, the thing you got to learn, and I hope I get this across more than anything today, is you need to learn how to critically look at science, okay? You don't have to know everything. You just got to know how to, well, show me your data. How did you, are you looking at each child? Are you looking at averages or what? Well, that's exactly what they're doing, is they're looking here at the relative difference, okay? Relative values are different than absolute values. Relative values are basically an average of all of the samples in each age group. So you could maybe have one age where, for whatever reason, they got a ton of decay, and maybe these other ages have none. Doesn't matter. We're going to average it all together, 18% decay rate, done, end of story. The absolute value is the average of, in one child's mouth. We have 128 tooth surfaces in a child's mouth. So you need to look at the absolute value. How much in each child at each age, that's the absolute value. So let me show you this. So if you look at this again, on the x-axis, we have ages, 7 to 17 up. And then the percent difference there on the y-axis, up to 32, average of 18. Now, let's look at the absolute. It's not too different, right? I mean, it definitely looks different, but look at the y-axis. Look at the numbers there. What's the top number, like 1.4? So let's put them together on the same graph. Look at that. So guess what really happened? It was, instead of being an 18% difference, it was a 0.6%. Okay, one surface of one tooth per mouth. That was the difference. And the only way we found this out was John Yamayanis, who was mentioned by David Kennedy today, a brilliant dentist, and the Safe Water Foundation said, can we see your data? Because we don't believe that. And they, of course, did the whole deal that you see on law movies where they send them 100 boxes, stacked up, good luck. And they went through it all with a fine-tooth comb. But by now, everybody had heard about this NIDR study, right? This huge study, right? It was 1986, 87. We all heard about it. 39,000 school children, all these communities. They did this test, and sure enough, this is what we came up with, 18% drop, fluoridation works. And we all heard that in dental school, or they probably still teach it. Well, that study was completely debunked by the Safe Water Foundation. And so you can see, look at that bottom level. That's the difference between fluoridated and non-fluoridated. And by the way, and here's the problem with these studies. When you look at a fluoridated community, they have delayed tooth eruption. Usually the first molars come in 6 months to a year after those in non-fluoridated. So what happens, right? They count the number of teeth and surfaces. Well, you got less in the fluoridated communities. So it's not a fair apples to apples, right? So it's already a bad thing, and the time trial is always too short. So none of these studies really have proven at all that it does any difference, really, between fluoridated and non-fluoridated. And I would argue that there's none. But if we're going to go by the actual data, 0.6% difference, okay? All right. So you guys already know about this, right? And I think it was 2011, the U.S. Public Health Service and HHS, Health and Human Services, recommended that we should drop the level in water supplies from an average of 0.7 to 1.2 mg per liter down to 0.7. And why they do this? Because they were seeing fluorosis cases go up. Now what they say is, we realize that they're getting fluoride from other sources, which is true. We don't need that much, but we still need it. So let's go to 0.7 across the board. And I can tell you that's impossible to do. I mean, there's places like Chicago where they're probably still well over 1. It just can't be done, especially in places where there's a lot of naturally occurring and they supplement it already. But let's just say they did, and it's on the up and up. Now we're down to 0.7, okay? So we're admitting that we're getting too much fluoride from other sources. We were told it was 41% of kids, every 2 out of 5 kids a few years ago have some form of fluorosis. The number now is looking like 65%, okay? And how we know this is there is researchers who do what's called the NHANES report, where it's the National Health and Nutrition Examination Survey. And NHANES is great because they look at all the demographic data, health indicators, other related information that are collected during household interviews. It's not just show me how many kids had it and how many didn't. They really get into it. And they do a fasting questionnaire file. They do a lot of factors to figure out what are the real numbers, okay? And I want to show you this. So Chris Neurath, who's a brilliant researcher, he's one of the main authors here, Hardy Lineback and Bill Osmondson, all dentists, except for Neurath. They looked at this thing from 1986 to 2012, and they found some really interesting findings here. So look at this. So when they're looking at these NHANES survey, as I've shown here in the orange, they look at a certain group of years, and they see what the percentage of fluorosis is. So in 12 to 15-year-old total prevalence increased from 22% in 86-87 to 41% in 99 to 2004 to 65% in 11 to 12 surveys. That's probably very accurate. The next one, he admitted to me, there's no way this could be accurate. Look at that. Combined moderate and severe cases, 1.2%, 3.7%, 30.4%. So luckily, I was able to reach him, and I had a conversation with him, and he said, listen, something's wrong. Either this report from the 99 to 2004 was wrong, or our newest one is there's no way it could jump from 3.7 to 30.4. And he's right, I'm sure. So they're still looking into this, and supposedly he was going to come out with the results very soon, and he may have already, but as of 5 or 6 months ago, he hadn't yet. So there's no way. I mean, but the point is it's going up. I don't think it's 30.4. Okay. So as I mentioned earlier, I graduated in 93 from dental school, and I thought when this came out just 2 years after I was just getting into it, and I thought, wow, this is the end of water fluoridation, because look at this in JADA. This article is infants' fluoride ingestion from water, supplements, and dentifrice, so that they're topical and systemic. But look at the quote. It's concerns about dental fluorosis and the paucity, meaning there was hardly anything out there, according to them. There was already a lot. But the fact that they were admitting we don't have a whole lot of information, I thought for sure that's it. Water fluoridation's over. And I was wrong. And then 5 years later, I thought this is definitely the end of fluoridation. John Featherstone, as I mentioned earlier, in JADA, huge article, Science and Practice of Caries Prevention, and he says unequivocally that the true predominant effect of anti-cariogenic activity is topically and not systemically. That's it, right? We just said you can drink it all day long. It doesn't have an anti-cariogenic effect, so it's topical only. I was wrong again. Didn't change anything. So let's get into some science. Like I said, I was going to do this, okay? You guys might know about the Bashash study in 2018, okay? Prenatal fluoride exposure and attention, ADHD basically. So they're looking at children 6 to 12 years old in Mexico City, okay? And I'm going to show you what they did here. So they measured the urinary fluoride levels, right? And they even adjusted for the creatinine. So they were collecting urine samples from the moms, and then they were following the children down the road to see what behavior was like in ages 6 through 12. And let me show you their results here. So look at this. So they measured I already said that one there, right here. Higher concentration of maternal urinary fluoride associated with more ADH-like symptoms in school-age children. Okay, and now, and this is just one study of several I'm going to show you in the past 4 years, maybe even less, where they're showing for sure changes in behavior, attention issues, IQ point drops. You're going to see. So now we're talking about a neurotoxin. We're no longer talking about, okay, it affects my pineal gland, hurts my thyroid, already terrible things. Now we're talking about you're affecting kids' brains, okay? So let's look at another study. Christine Till, who, by the way, spoke at our last meeting in Nashville via Zoom. It was incredible. But on a side note, and this is sad, she gave a great presentation on this study where she looked again at urinary fluoride concentrations to see what was going on with the kids. And after she finished speaking, we did sort of a Q&A on the microphone with her, and I asked one of the first questions. And I said, and you can see this online, I'm sure, I said, are you worried at all about what you just presented about maybe losing some glands? Or she went, what are you talking about? She goes, that's never happened. I go, well, what's happened? And she goes, no, I'm not worried about any of that. And what happened shortly after? She was getting bashed by her colleagues and being told that what she presented was not accurate, and she's going through it now. And it's sad because she was trying to share science. This is a really good study, by the way. Let me show you her methods. So almost 1,600 pregnant women, right, again, measured the maternal urinary fluoride concentrations in spot samples. Okay, and you guys can read all that stuff. They even looked at things like tea consumption, right, other fluoride exposure. So she was trying to be very careful on making sure she differentiated between people who were just drinking fluoridated water and those who were maybe doing a lot of tea and stuff like that, okay? Let me see if we've got results for you here. Look at this. The MUF values were nearly 2 times higher for pregnant women living in fluoridated regions compared with non-fluoridated. Okay, so again, she's looking at all these. She looked at a lot of other intakes with regression analyses, meaning we're going to rule out other things and just compare fluoridated versus non-fluoridated. And these were the results she got here. So let me show you another study that I think is actually even better. So this is Rivka Green. This is 2019. The last one was 2018. So I'm showing you very recent stuff here. Association between maternal fluoride exposure, again, during pregnancy and IQ scores. So now we're getting into this, right? And by the way, this was in JAMA Pediatrics. You guys probably saw this or heard about it. The editor of that publication, Dr. Christakis, for the first time ever, wrote an editorial note as a preface to the study. And he did this, and I applaud him. He's an MD. He wrote, not only did he write a preface, but he actually did a little short blog where he had a discussion with another guy named Dr. Rivera, and they were blown away by this study because they believed that fluoride was good. But he wrote an editorial note because he knew that people were going to try to bash it. So to his credit, he said, I've never seen more rigorous stats, more rigorous data. This is an incredible study. And that's why they published it. Okay? So let's look at what, I think I've got the results here. Let me just read it to you here. So 2 measures of maternal exposure, right, over 3 trimesters, and then a questionnaire of maternal fluoride consumption and exposure from fluoridated water or not. So they looked at lots of areas, fluoridated versus non-fluoridated, okay? The findings, mothers in fluoridated areas had higher fluoride concentration in their urine, but the boys that were born to those moms had IQ point drops of 4.5 points. So 4.5 is significant. Young girls, not as much, sometimes not at all, but for whatever reason, young boys, 4.5 IQ drop, okay? Then, when they measured the fluoride exposure by examining the women's fluid intake, like black tea, things like that I talked about, they found lower IQs in both boys and girls. So now we're talking about naturally, and it might have been the combination of natural and industrial, of up to 3.7 point drops. So, and she did a ton of sensitivity analyses. It was a great study again, okay? And this confirms the findings of the Bashash study and TIL. We've now got all these studies happening in a short time, 4 or 5 years, where they're looking at IQ effects and ADD, ADHD. So we're seeing a lot more than just what I mentioned earlier. Okay, you guys have all seen this, or at least one like it. This is World Health Organization, and what it's showing you is basically decay rates dropping all over the world, but can you point out which ones are fluoridated and which ones are not? I mean, I'll just tell you that red is fluoridated, blue is not, but, basically what they're saying is it has nothing to do with that, right? It's either they're getting better with their diets or education or whatever it is, but it's not adding industrial fluoride to the water. That's the point of that slide. Remember the guy on the video, the very first video, Myron Alukian, I showed you him? Okay. And what did he say? He said, go to reputable sites like CDC, ADA, and ILikeMyTeeth.org. He made sure that he said this site. So I thought, I'm going to go check out the site. So I like to look up things here, and I like to follow where they say they're coming. This is my favorite part. This person writes into ILikeMyTeeth.org and says, I found an article on the internet about something called fluorosis. Is that a reason not to fluoridate drinking water? And they say this: a study published in 2010 found that mild fluorosis was not an adverse health condition and that it might even have a favorable effect on overall health. Which, first of all, is a stupid statement, but let's just say it's accurate. So I like to follow the science here. Look at that, guys. It's a news release from the ADA. Okay, here's my point. If you're going to make a bold statement like that, you better have something to back it up. And a news release is not science. It's just not. I don't care who released it. It's not science. And we'll see a lot of this coming up here. So, Myron Alukian, I wanted to show you, he's the guy there on the far right with the hat. These guys formed what's called the American Fluoridation Society. Remember when I talked about Ed Bernays earlier? There's a few guys that control everything. These guys wish they were those guys. And they formed in 2014, and I think, my guess is that it was formed because the Fluoride Action Network and groups like us were getting pretty powerful, getting a lot of information out. So they needed to have some kind of a group out there with experts, if you will. They're all doctors. Basically, they're the ones that will show up at a lot of the battles. I did a Zoom battle with some people in, I can't remember now, I think Minnesota. And that middle guy, Dr. Johnny Johnson, was on the phone call. And, he likes to spout a lot of stats and stuff. So, you can always counter it. But my point is that they're trying to get out there and fight for fluoride. So. Okay, remember I mentioned this earlier. We keep hearing this, right? It's always spouted by the Surgeons General and anybody that's promoting fluoride. They always say it's one of the 10 great public health achievements of the 20th century. That phrase was coined, by the way, by two people in CDC. One of them's not even a dentist, so it's not like it's a world-renowned agreement on this. It was two people that said, that sounds good. Let's do this. And everybody runs with it. So what does the FDA say about fluoride? Do you guys know? It's unapproved. They've never approved it. No fluoride containing supplements as prescription or over-the-counter drugs have. So none have ever been approved. So you know that as a dentist, you can prescribe whatever, tabs or whatever, and they can go to the pharmacy and get it, and it's all hunky-dory, but that's not legal for either of us, especially not the pharmacies. So a few years back, our academy, along with the Fluoride Action Network, we basically did a public service announcement out there saying that the FDA needs to do their job. They need to actually enforce their own rule, that they've never approved it. And nothing's happened since then, but we certainly made an effort. Okay. This is one of my favorite slides, and I don't know why no one seems to laugh as much as I do, but let's try. Okay, so I just told you this, right? It's never approved fluoridation nor banned it. They haven't approved anything as far as fluoride, right? But let's just be specific on fluoridation. 1979, they said, you know what, we don't even want to deal with this. How about we give it to the EPA? They can deal with it. EPA says, we don't want to approve it either or ban it, so we'll pass over to the National Sanitation Foundation. And we're going to lend you some people, and let's do at least 20 studies, toxicological studies, to show that we did our due diligence, and we'll give it like Rule 60, we'll call it. So if they have Rule 60, that means it went through a lot of rigorous studies to prove that it works. Guess what? NSF says, we don't want to do that. No studies are ever done, and yet NSF allows venous fluoridation to use the NSF mark, a symbol of compliance with Rule 60. Thank you for laughing. It's silly. And I got this from an attorney. It's not like I made this up or tried to put it together. I mean, this is exactly what happens, right? And I would have never known this if I didn't dig deep. I would have thought, okay, they got the NSF rule. I guess it's been through a lot of stuff. It hasn't. You need me to move or anything? You good? Okay. Let's do this video. And it's very, very short, but I want you to listen to her carefully.
Fluoride has been studied for many, many years, and there's never been a scientific study that has determined definitively that fluoride is related to any health risk.
So I hate the word never, but I'm going to use it correctly here. Okay? There has never been a single randomized clinical trial to prove that it actually works or is safe. You guys know that? Never. Even that 86-87 study was not a true randomized clinical trial. That's how science is done. There's never been a long-term follow-up study to prove that it actually worked. And on the flip side of that coin, San Antonio, where I grew up, thank God I grew up there because they didn't fluoridate till 2000. I was already grown and practicing dentistry, so I'm kind of grateful for that. But in 2000, they finally decided to do it. And what they did was they actually, somebody there in Bexar County actually followed to see, well, let's see if it works. It's called the Metro Health Department. After 9 years, 2009, and $3 million research, they looked to see, has it done anything? Guess what happened? Decay actually increased 13%. Now, I don't know, it's not because of the fluoride, but I'm just saying it increased. I don't think it is. I mean, it could be a lot of factors. I mean, you can't just, it's hard nowadays, right? We don't know what they're eating, San Antonio. I mean, who knows? But the bottom line is it didn't go down. It went up. Okay? It's crazy. And by the way, too, this last one, silicofluorides, remember, that's the same thing as the hydrofluos. It's just such a long word, so we'll call it silicofluorides. Have never been FDA approved for ingestion, and they were never proven safe prior to dumping on our water supply. Remember, it was a waste product. You had to put it somewhere. It's not allowed to be dumped in the ground according to the EPA, and you can't let it go in the air. So you got to put it somewhere. So again, that gets into a very sordid tale of how they ended up putting in our water supply. And don't let fluoridationists fool you and say, listen, silicofluoride, I hear what Griffin's saying, but silicofluorides, they dissociate in water just like calcium fluoride, because that ain't true. And it was proven, or disproven, that it did that way back, look at this, 1975, okay? Johannes Westendorf in Hamburg, Germany, was doing his thesis for his PhD, and he was trying to do it on the anti-carcinogenic effect of fluoride. He thought it'd be kind of neat to do a study on that to see how it works, including silicofluorides. Well, lo and behold, in his research, he found that silicofluorides did not fully dissociate in water. So this was huge because now he changed his whole thesis here. Look at this, the kinetics of acetylcholinesterase inhibition and the influence of fluoride and fluoride complexes on the permeability of erythrocyte membranes. You guys know what acetylcholinesterase is important for, right? All of our neurotransmitters, how our neurotransmitters work, how everything works in our brain with the dopamine and everything else. I mean, this is like a critical enzyme, and they showed that too. Do you need anything? Am I on your way? Okay. All right. Oh, by the way, too, researchers in 2001 at the same time, with the same topic, I should say, found that SIFs, silicofluorides, cause a higher absorption of lead in children. Lead, it exacerbates lead, and decreased cholinesterase again. So it's all about our neurotransmitters here. Okay, this guy again, remember him? Let's see what he says now.
Cause of fluorosis is likely that kids do sometimes have a habit of swallowing their tooth. Fluorosis is the reason that the American Dental Association recommends that children under 6 do not use more than a pea-sized amount of toothpaste. We assume that little kids are going to swallow it, and if they swallow a lot more than that pea-sized amount, they're more likely to get fluorosis. Toothpaste delivers a much more concentrated amount of fluoride than drinking water does. So the biggest cause of fluorosis is likely swallowing toothpaste, not water.
Seriously. Come on. Okay. We talked about this just briefly earlier, but let's get into a little bit more. So this is my big concern, and I feel like this is the ultimate argument, right? If you go, I don't care what you want to argue, it doesn't work, it works. To me, it's all about dose control, right? This is the only medication that we don't need a prescription for, that we don't even ask for, and there's no dose control. So a bottle-fed baby, remember I told you, if that baby's drinking only formula, for whatever reason, water's the predominant ingredient. So look at this. You probably know this, right? In breast milk, there's only 0.004 parts per million of fluoride. That's all you find. It's created very nicely that way. And so when you're drinking it from tap water, you can get up to 250 times and even higher that as compared to the mother's milk. So I mean, these poor babies don't even have a chance. I think this is the ultimate argument. That's what I think. Okay, let's look at this again. I like to look at things that are official. Don't worry about reading the words. I'm gonna make everything clear to you guys. But I just wanted to show some content here. But this is a letter in 2016 from the ADA. Okay, and they're writing it to the environmental health sciences. Basically, they're saying we love that you're looking at to see if fluoride is a potential carcinogen. We'd love to help you with this. We'll give you information. This is how we feel. So look carefully at what they say here. I'm going to highlight things. Last April, the U.S. Public Health Service noted there was no compelling evidence that fluoride is associated with osteosarcoma, bone cancer. So we got to follow those endnotes, right? Look at them. Press release from HHS and a statement. I mean, that's not science. I mean, if you're going to make a bold statement like that, you're going to at least have to say, based on this study or whatever, right? Something. Let's go a little further down the letter here. The announcement was based on 4-year evidence review of the effects of fluoride on human health, including any potential links with cancer. After careful review, the USPHS concluded that the available literature does not support classifying fluoride as a carcinogen. This has got to be scientific. It's a recommendation. I mean, I'm reading that carefully, right? That's all it is, just a recommendation. So it's, again, if I'm this group, I'd be like, well, we need a little bit more than that. I mean, give us something. So remember I mentioned this earlier, that it used to be free. Now you got to pay to get access to it. But fluoridation facts, and I can tell you this without any hesitation, there's very little facts in that whole. It's like a 75. It used to be 75 pages. Now it's longer now because they've added some things, mostly some things that will counter stuff I'm going to say to you right now. But it's a long document, and they've got, just so you know, they've got 359 references at the time. Again, there's probably more now, so I looked at every one because I wanted to see, you know, how much was peer-reviewed or not. And 98 of them at the time, there's probably more, which was, you know, 27% of the references were from, are you ready for this? Internal documents, in-house reports, committee reports, surveys, symposiums, federal registers, lawsuits, monographs, press releases, Gallup studies, letters to the editor, and personal correspondences. That's 27% of the references. Okay, all the rest, the majority of them, were from a thing called Carey's Research, which is not peer-reviewed. So just as a guy that likes to look and say, well, maybe, I want to make sure I know what I'm talking about, that's unacceptable. Even if you got 10 that are from the New England Journal of Medicine, Lancet, whatever, the fact that you have most of yours from a non-peer-reviewed journal, and then I mentioned all those other things, is just not science. But let's go further. So this is a statement in there, and it says, fact. As discussed throughout this document, the best available scientific evidence consistently has indicated that fluoridation of community water supplies is safe and effective. Okay? And then it says, of the thousands of credible scientific studies on fluoridation, none has shown health problems associated with the consumption of optimally fluoridated water. None has shown it. Okay, let me show you something here. So just according to the Fluoride Action Network, right, their health database, there are over 270 published fluoride studies on the kidney, over 140 on the liver, 350 published studies on fluoride's effect on the brain, and now more, 130 human studies, over 200 animal studies, and 33 cell studies. None of these are credible? Let's look at some more things here. Water fluoridation is an effective and inexpensive means of obtaining the fluoride necessary to prevent tooth decay. So look at the little end note 3. Studies show that water fluoridation continues to be effective in reducing tooth decay by 20 to 40%. Again, those numbers, I'm not sure where they got them, but let's see if we can follow this. So on the 3 thing, that's recommendations, again. And 22, their own fact sheet. Really, you're going to cite yourself? I mean, I'm just saying, come on, at least, just give me something. Give me something that shows that, yeah, we did our study too, and we found this. So here's where they get a lot of their stuff from. The U.S. Preventive Services Task Force recommends the clinical use of oral fluoride supplementation starting at age 6 months through 5 years for children whose water supply is deficient in fluoride. And now in this country, there's very few that are. But let's follow that. Final recommendation statement. Tell me if I'm crazy. You guys may have seen this little graph. I like this one here. This is the association between fluorosis and dental caries. So if you look at the graph there, the blue is fluorosis, okay? So the x-axis is the amount of fluoride in the water. The y-axis is the percent of children that have the effect, okay? The red and white stripe thing, that's caries. Okay, so when you look at less than 0.3 parts per million of fluoride, you got a little bit of fluorosis, a lot of decay. Then you go to 0.3 to 0.7, a little more fluorosis, pretty much the same amount of decay. 0.7 to 0.12, more fluorosis, same amount of decay. Greater than 1.2, a lot of fluorosis, pretty much the same amount of decay. You get the point here? Doesn't really matter, right? Okay, let's do more science. this is another thing from Fluoridation Facts. So I'm now going to cover things that they actually say. Does fluoride, as provided by community water fluoridation, inhibit the activity of enzymes in humans? Answer. The best available scientific evidence demonstrates that the recommended levels of fluoride in drinking water has no effect on human enzyme activity. Now, so that day I thought, I'm just going to do a search. I don't know if it was a Google or Yahoo. It was a Yahoo search. Can y'all see that? This is the first page. Every single one of those are about the effect of fluoride on enzyme activity, and every single one looks pretty good. One's from our government, pancreatic, digestive, you name it. It's all pretty good stuff. Now, that's not science, but I just wanted to show you that just doing a simple search, I found this. So let's actually get into some science here, okay? Okay, does the ingestion of optimally fluoridated water adversely affect the thyroid gland? And we know it does, but let's just look at it. Answer, they say it does not. Fact, a number of systematic reviews completed in the last 10 years have looked at a possible association between exposure to fluoride and thyroid function. Yes, they have, and they've showed a definite association. So that's a factual statement, but you notice it doesn't make a statement one way or the other. It just says, we've looked at things. And here's what they quote a lot. They quote SCHEER, which is the Scientific Committee on Health and Environmental Risks. I'm not saying this isn't scientific. It's by the European Commission. But you're going to see here in a second here how SCHEER just basically says, that sort of echoes what they say already here. So, critical review of any new evidence on the hazard profile, health effects, and human exposure to fluoride and the fluoridating agents of drinking water was released in 2011. It stated that, quote, a systematic evaluation of the human studies does not suggest a potential thyroid effect at realistic exposures to fluoride. Okay? And there's the end note, and it's basically just them. And that's fine. Again, if I'm not saying it's not science, I'm just saying that they're basically just quoting themselves there. So, let's look at some studies. This is 2018, guys. Impact of drinking water fluoride on human thyroid hormones. Case control study, okay? Let me see if I can show you some of this here. So this study compared the measurements of the average amount of thyroid hormones, T3, T4, and TSH, in people with thyroid disease, and then they looked at ones that were affected by fluoride. The major finding of the study was that the TSH values, right, the thyroid stimulating hormone, were much higher in areas with a higher fluoride concentration. So this is scary, right, because we need to make T3 and T4. And if we got too much TSH going on, we're going to be hypo, right? Unless there's a tumor, that's different, because now you're feeding it. But otherwise, your thyroid's going to definitely be affected by higher fluoride contents. 2018. Look at this one. 2014, Springer Plus. Springer Plus is called something else now, but it is a peer-reviewed journal, but it's called something else now. This was looking at fluoride ingestion levels, again, thyroid hormone and TSH level derangements, and dental fluorosis among school children from endemic and non-endemic fluorosis areas. 2014 conclusions. The serum fluoride concentration significantly altered thyroid hormones, T3, T4, and TSH concentrations. Okay, so they were increased in both groups in areas of more fluoride. 2014 peer-reviewed. Look at this one. This is the Journal of Contemporary Dental Practice, okay, a mainstream but peer-reviewed journal. Fluoride thyroid hormone derangements and its correlation with tooth eruption patterns among the pediatric population from endemic and non-endemic fluorosis areas. Okay, their conclusions, positive correlation, again, between fluorosis and thyroid functional activity. Why are these studies not acknowledged? I mean, if you're going to make a statement that there is no studies to show any thyroid harm, why am I finding these? And these are recent peer-reviewed journals. Look at this one. Fluoride exposure and thyroid function among adults living in Canada. Effect modification by iodine status. Now this one, let's look at this one closer. Okay, look at this. Almost 7 million adults in Canada, aged 18 to 79, who were not taking any thyroid-related medication. Not only thyroid medication, thyroid-related. So they were very careful. It's a lot of people. Okay, urinary fluoride concentrations are measured, spot samples, right? Serum TSH levels provided a measure of thyroid function. So they could look at this, and again, they used a lot of regression analyses, meaning they were ruling out other things. They wanted to say, we want people who aren't taking any thyroid medication or anything that even could affect the thyroid to see what they found, okay? Let me go back here. The results, Adults in Canada who have moderate to severe iodine deficiencies and higher urinary fluoride levels had higher TSH levels, right? Hypothyroidism, T3 and T4 are low, high TSH. Okay, remember, fluoride's going to beat iodine to the thyroid every time. That's the scary thing. It's the most reactive element on the entire periodic table, but certainly in the halogens. So that's why this is a big deal. Okay, let's move on. Let's go to another very important organ. Is the consumption of water levels harmful to kidneys? Answer. Consuming water fluoridated at recommended levels has not been shown to cause or worsen kidney disease. And look at this. Now, it's a fact. However, several large community-based studies of people with long-term exposure to drinking water with fluoride concentrations up to 8 parts per million have failed to show an increase in kidney disease. So they're really going high. 8 parts per million? I don't even think Lubbock is that high. I mean, that's a high amount. So let's look at their science here. They got 2 endnotes. Let's follow them. Okay, the first one is from JADA. That's cool. I'm good with that. That's peer-reviewed. 1956. And the next one is also JADA 1958. Now, I'm not saying science wasn't good in the 50s. I'm just saying this is what you're using as your references. 1956 and 58. Got a lot of science since then. And by the way, that first one, 136 with Schlesinger, that had nothing to even do with kidneys. It was just a comment that was made in passing in that study. So I actually do read some of these, you know. Okay, let's keep going. Effect of water fluoridation on the development of medial vascular calcification in uremic rats. Okay, so this is just basically a study. They were studying the effects of water fluoridation during the course of vascular calcification in renal disease. Okay, so and it's rats, obviously, not humans. Let me just get this down here where I can give you guys some results here. Okay? So here's the deal. The World Health Organization even recommends a certain concentration where they feel like things will be safe, which is 1.5 mg per liter, okay, milligrams per liter. Well, what we found in the study is that concentrations that low in drinking water becomes very nephrotoxic to people with CKD, chronic kidney disease. So they have more effects on their kidneys in fluoridated areas. So this is a definite correlation between fluoride and the kidneys. Let's go to another one here. Exploring the role of excess fluoride in chronic kidney disease, a review. So this review covered 100 years of studies on the kidney. No kidding. On the toxicity of fluoride on human and animal kidneys. 100 years. And they revealed that there are direct adverse effects on the kidneys by excess fluoride. Okay, it leads to kidney damage, dysfunction, and as I mentioned earlier, with the exception of the pineal gland, right, the kidney is very highly affected, as is the thyroid. So, I mean, again, just plain, clean science. This review proposes that there is a direct correlation, again, between CKD and the consumption of excess amounts of fluoride, not even high amounts, by the way. Adverse effects on the tubular area of human and animal kidneys leading to CKD. So some of these patients or these animals, if you will, didn't even have kidney problems, and they developed them after being exposed to fluoride. So worsens it and causes. Now, this is the only old study that I have. It's not even that old. It's 87. But I thought this was a neat study because it was a study on one child. They followed this one child. It was interesting. It was about 32 years ago, I guess, or so. One case of excess fluoride which caused renal failure in this child. And there were very few studies prior to that even looked at the kidneys. So what they did was, because the child was so aged, they could follow this child. They knew how much fluoride this kid was exposed to. It was a long duration. And the absence of any other renal issues that would cause renal insufficiency. So they were able to definitely show a causal relationship between excessive fluoride exposure and kidney failure. Just a cool study, you know, and if you ever get a chance to read it, 1987, okay? It was at the American Journal of Kidney Diseases, peer-reviewed. Let's go to another one. This is all from Fluoridation Facts. Does drinking fluoridated water increase the level of lead in the blood or cause lead poisoning in children? Answer, no. The best available scientific evidence has not shown any association between water fluoridation and blood lead levels. And then a fact. A number of reviews and data analyses indicate no association between water fluoridation and blood lead levels. So let's follow that scientific thing. Yeah, sure. Again, I'm not saying that they're not giving good information here, but they're basically just quoting these. Whenever they quote someone that's not them or a recommendation or a statement, it's these guys. And I'm going to tell you right now that we absolutely know that fluoride has an effect on lead, that increases lead exposure in children. And I'm going to even talk about pipes here in a second, how it affects pipes. But let's go into some of these things. Here's some science. So the association of silicofluoride treated water with elevated blood lead, Masters in Copland, this is 2000, neurotoxicology, again, peer reviewed, okay? This was a study of about 152,000 venous blood level tests, blood lead tests, taken from children birth to age 6, okay, living in 105 communities of populations from 15,000 to 75,000. And they were just looking at this study, kind of looking at a bunch of children. It was mostly in New York State, and they were trying to see, you know, what's going on, what happened. Here's the results. For every single age and race group, there was a consistently significant association of silicofluoride treated water and elevated blood lead. We know this. Fluoride exacerbates the effects of lead highly. Okay, here's another one. Fluoride increases lead concentrations in whole blood and in calcified tissues from lead-exposed rats. So let me get to that one real quick here. Okay, so this abstract was similar, right? They were looking to see children who lived in these communities that had fluoride-treated water or didn't, and they were seeing what happened in rats here. And their results, higher lead concentrations were found in the calcified tissues in the fluoride plus lead group compared to the lead group only. So rats being fed lead and fluoride and just lead, threefold higher lead concentrations when fluoride was added. Okay, rat study. Good one. Okay, here's another one here. Confirmation of and explanations for elevated blood lead and other disorders in children exposed to water disinfection and fluoridation chemicals. Okay, this goes on and on, right? Children that had elevated blood lead were ones that was much higher in fluoridated communities versus non-fluoridated. That's what it's showing. And by the way, too, they showed that in this same review that any kind of water that had the silicofluorides added, there was serious corrosion of lead-bearing brass plumbing. And I'm going to get into that with Flint, Michigan, right? Because I'm telling you right now, they talk about lead, but it was fluoride, the added fluoride, what made those pipes corrode and open up, and lead was exposed, and they poured the water out, it's brown. They talked about lead. They never talked about what caused that to happen, and it's these silicofluorides. Make no mistake about it. We know that for sure. So let's talk about that. Does fluoride at levels used in fluoridation corrode water pipes? What do they say? No. Allegations that fluoridation causes corrosion of water pipes is not supported by scientific evidence. Let's talk about Flint. I'm telling you right now. So we know that silicofluorides going through any pipes that have lead in them is going to make that come out faster. And it's going to happen all over. It's already happened in some places here, but look at this. There's been studies that have shown that children, again, living in areas with the silicofluoride treated water have higher levels of lead in their blood. Okay, 20% more than those without, according to the CDC. But the CDC has yet to warn us about this or say anything. Okay, but there's been some examples already. 2009 in Thunder Bay, Canada, they added the silicofluorides and they changed the pH from 7.54 to 7.27, tripling the rate of lead leaching from those pipes. Tripling. San Francisco water plants in 2010 had to add caustic soda because the pH was so corrosive at that point. Okay, just by adding silicofluoride to it. Now Flint, right? They had no offsetting procedures, and look what happened. And at the time when I first talked about this, I said others to follow, ? And I think it was 2 years later when Sandy, Utah happened. Same thing, they had a big accident happen. So let me show you this real quick, and I won't even read them, but they'll go fast. These are 55 disasters since 1972 with something happening with pipes and or something at the fluoride treatment plants. And this doesn't even include Flint or Sandy, Utah. There's actually a couple more. But the list goes on and on. Maybe you recognize some places. Okay, this old one, this is the oldest one. I said 79 was, but 71. I wanted to show this one because I find it interesting. So we're talking about our food supply here, right? So this study was looking to see the effects of fluoride in agriculture. You know what the results were? Fluoride was the worst pollutant to affect plants and horticulture. The worst out of all the pollutants, and they even included pesticides and all kinds of stuff, and fluoride was the worst. So we're talking about our food supply here, guys. How we doing on time? We good? Good. Thank you. All right, let's do a few more is all I got left. So you guys, I mentioned Calgary earlier. This is an important deal, right? Because Calgary's gone through fluoridation and not fluoridating, and in 2011 they stopped it. And they said, you know what, we've seen enough evidence, we're done. Well, lately, pro-fluoridationists and other experts were coming out saying, no, we got to fluoridate again. This is bad. We're seeing kids' decay rates go up. This is not good. So credit to the city council. They said, you know what, let's get the O'Brien Institute in, because the O'Brien Institute is pretty brilliant. And let's let them look at things, and then they'll guide us, and then we'll go from there. So the O'Brien Institute was hired. They conducted a review. They published their report in July, highlighting the neurotoxic risks posed by the fetus. So they literally told them, yeah, there's a problem. So what'd they do? They voted 13-1 to forget their presentation. We don't care anymore. Okay? So this is still going on, by the way, and it is crucial, right? Because, you know, a fairly large percentage of Canadians have fluoridated water, not as much as us, obviously, but they're going to influence other cities. So it's a big deal, right? And again, there's been plenty of experts like the Fluoride Action Network, other, you know, great experts out there telling them, don't do this. You made the right decision to stop it. Don't go back. But let me show you how they play games with stuff. So I purposely left out part of this graph because I want to show you what they do. They say, look at this. In 2015, look how decay rates went up. Okay, that's when they stopped fluoridating altogether. They say, look at that. Fluoridation ended, between mid-2011, ended there, and look how decay went up. All because we stopped fluoridation. Well, look at the whole graph. Decay rates were going up anyway, for whatever reason. But you got to show the whole thing. You got to give context here. So going back to, what is that, 2005, look at that. It's linear. It was going up. You can't just show half the part of the graph and say, look, we proved our point. So it's very clever how it's done. Now, granted, they had it laid out more prettily than I have, but I wanted to show you the whole picture here. Okay, real quickly on this, the National Research Council, you guys probably know about this. So they were hired by the EPA to look at the standards of fluoride in drinking water back in 2006. They got experts. It was 12 experts, some dentists, some brilliant scientists. And they just wanted to say, you know, what'd you find? What should we do? And this was one of the quotes from one of the experts there. Said, fluorides have the ability to interfere with the functions of the brain and the body. And the chief endocrine effects of fluoride include decreased thyroid function. So they asked him, okay, that's fine. Right now, the MCLG, the minimum contaminant level goal, the level where we can guarantee no harm, right, is at 4 parts per million overall. That's the level that we feel good. What do you think it should be? And they said, honestly, 0. But it should definitely be lowered. Still hasn't happened. I just wanted to show you this. This is comparing arsenic, sodium fluoride, and lead. Sodium fluoride, not even silicofluorides. Arsenic's the far left, the middle's fluoride, lead is the third. Look at that. This is showing how it affects the central nervous system. Again, neurotoxicity. NRC report, fluoride's higher than lead. Okay, I'm a big fan of the Fluoride Action Network. Again, it's a Paul Connett-run organization where really their whole goal is just to inform the public of what's going on with fluoride. Okay, and here's some stats from them. Out of 196 nations, only 24 fluoridate. Again, I mentioned 95% of the world's population doesn't do it, and only 4 of 48 European countries fluoridate, less than 2% of the population there. These are sources of stuff. There's so many things, but I highly recommend all of these things. Professional perspectives on the lower right corner there, that's a bunch of experts being interviewed. The Case Against Fluoride in the top right corner, that's Paul Connett's book. Dave Kennedy's wonderful Fluoride Gate. There's lots of stuff. It's great information. So literally there's like 2 or 3 minutes for questions if anybody has anything. What? You got to switch? Okay. But I can answer while she's doing that. Just one question. Go ahead. Okay. She want to know what company makes the silicofluorides. Mosaic is the biggest one. MOSAIC. There's probably a few. We get some from China and from other countries. But in this, Florida, by the way, is where Mosaic, I think, is. Yes. And most of the stuff comes from Florida and is trucked and bussed over to all the city municipalities, and that's where we get the water. And just real quick on that note, so in Austin, Mosaic had recently in 2011 they on their MSDS sheet, their actual report that's for workers, they included a whole thing on fluorosis. And that's interesting because why would you care if your workers know about that? It has nothing to do with your workers. It has to do with the children. So it was basically, I think, to take off all liability and say, now it's on the city councils. We got no liability. Mosaic. Good question. Thank you very much, guys. Appreciate it.